Having trouble getting a call back from a therapist in your insurance's network? Here's what to do. I've actually been trying to seek a therapist through my HMO insurance for quite some time. Their network is rather restricted, but they were giving me various names of people that supposedly could help me as an autism patient, which makes it even harder to find somebody who will help somebody with autism. And I would call many of these therapists. I would leave a message. I'd call them multiple times, not get a call back at all. Some of them I noticed had voicemail boxes that were not set up, not taking any calls, and they didn't answer the phone. Even when I called back and had a customer service rep try to call this therapist, they still wouldn't answer even for them. So I've actually done a few videos on the written grievance mechanism for getting your insurance to resolve issues with a doctor or with another provider or with quality of care or billing. But the customer service representative actually educated me that I could use this process to deal with therapists who weren't returning my call and encouraged me to do so. There's actually a widely reported upon phenomenon of what are called ghost networks, where an insurance company will claim to have more mental health providers than they actually do because they keep people in that are not accepting new patients. They keep people in the directory that are out of business. There's some story of a person who called a therapist phone number and got a McDonald's. Thankfully, I haven't had that one happen yet. Um, but what doing the written grievance does is it helps to alert the appropriate people of the issue. In this case, the grievance department investigated it and they actually sent me back a letter within 30 days, and they managed to get me an appointment with an autism specialist therapist because I complained about it. But it also helps to point out if enough people complain that 50% of these therapists in your network are fake, those statistics get compiled and reported to the appropriate authorities, and they can't just claim ignorance because they have to investigate these things. They had to actually go and call and probably send a letter to this other therapist who's basically just gone AWOL. Um, so you're not just helping yourself possibly get an appointment, you're also helping to bring attention to a systemic issue if enough people do it. So if you're getting weird voicemails that are not the therapist, you're not getting calls back, be sure to file that written grievance because it can help you and it can help others.